Dr. Derek Lawrence here at Revive Naturopathic Medicine. And if you didn't catch out our shockwave video, this is a continuation of that. So this is Randy here. We've been treating a chronic overuse injury in his forearm. We just did a shockwave treatment, and like I said, if you didn't catch that video, go watch it. And we're going to follow that up with a low-level laser therapy. I often use these two treatments in combination because I find they really expedite not only the healing, but also the pain reduction very quickly. The shockwave therapy really shakes some things up. It is a slightly kind of traumatic to the particular tissue we're treating, and the laser kind of calms everything down on that front. So I want to talk to you a little bit more about how low-level laser therapy works and why we use it. Alright, so Randy, we're going to do some low-level laser therapy over your forearm, wrist, and hand, just like we did with the shockwave. I want to tell you a little bit about low-level laser therapy first. So this uses laser and or LED light, okay, particularly in the kind of red and infrared spectrum. Why we use this is because there are particular parts of our cells called our mitochondria. Do you remember like back to high school when you learned about mitochondria? The little power plants of all your cells, they produce energy, right? So that's like what your muscle cells and ligament cells, etc., they use as energy. They are actually sensitive to particular wavelengths of light. And when you apply infrared light, red light, and other colors in the spectrum as well, it actually upregulates how fast they work, and then you make more energy in that particular area. So from some of the research, it's been shown that one, it actually helps reduce pain, helps speed healing. So it's actually bringing anti-inflammatory kind of cell chemicals to the area, but it's helping tissues repair faster. And if you think about it, it makes sense, because if you're giving more energy to an area of injury, your body's trying to repair that. All you're doing is kind of putting lighter fluid on that and making it work a lot faster. It's one of the reasons why I love low-level laser therapy, is because it's really just stimulating your body's own inherent capacity to heal without any side effects, right? And really without any sort of kind of like needing to take any medications or biochemical substances to actually change that. We're just using light.
Cool.
So because we will be using laser light, we like to use precaution and put on goggles so that we protect your eyes, and I'll put on a pair as well.
Ooh.
It's a good look. And we'll start by treating it. So we tend to do a few focused spots on the area that we're concerned about. So we identified some tender spots up in the forearm extensors of here, in the forearm flexors over here, okay, down in what we call the thenar eminence, or your big fat thumb muscle, right? And then a little bit in the hand. So we'll focus on those areas in particular. This particular probe will be able to go about 5 centimeters deep, so we're able to get pretty good depth of penetration in there, so we'll be able to bathe all the ligaments, tendons, muscles in there. So you can rest your arm here. You don't necessarily need to look at the light, but you can if you need to. Okay. It's going to be on your skin. So, as you can tell, you can't really see or tell if anything's on, but if we lift this just off the surface, you can see there's a slight red light flickering there. Yeah. So we'll keep this here for, like I said, 1 minute each spot, and then you'll be on your way. So that's it. That's low-level laser. As you can see, you don't really feel much with that. A lot of times it will actually kind of calm down any irritation that's going on. But again, just like the shockwave, give that a day or two to kind of sit and see how everything feels. And then when we follow up next week, we'll probably do another treatment and see how it's progressing.
Sounds good.
Right?
Thank you, Doc.
Thanks, Randy.